Welcome to Medical Malfunction, and today we're going to talk about the salaried model of physician care versus basically the difference is that when you go to a hospital, obviously this week I had a procedure and we've been talking about that a good bit, and there's been a fair amount of talk about the patient-centered experience over the last few years and how some systems and some provider professionals are better at it than others and what makes the difference. And there was a really good article this week actually that came out from a physician who actually has, they've retired and so they're not practicing anymore. So now they're a patient, and it was actually a male physician, and he's had procedures done in 2 different health systems, and one of them had a salaried model and one of them didn't. And I'm going to tell you off the top of my head, can you guess what the difference is? A salaried model versus a not salaried model. And as soon as I tell you what the difference is, you're going to know. Oh yeah, we've experienced this. Okay. So a salaried model is basically, if you're in the health system, what they do is they hire physicians completely. Like they say, you come and work for us, we're gonna pay you a salary, and then we're gonna cover all of your costs, all of your expenses. You do your research here, you do your work here, you care for your patients here. You don't have an outside practice. That's it, you work for us, right? That's a salaried model. And what that does, they probably take care of like insurance and everything, just do all the things for the physicians. Now, in most places, what happens is the physician has their own practice. It's outside of a hospital, and then they get privileges to perform procedures or practice or see patients at a hospital. So they might be privileged at a number of different places. But the difference is when you go to have a procedure at that hospital, you get 47 different bills, right? This is the thing people complain about. But that's kind of we talk about fee-for-service and how it's a fee-for-service business, healthcare in America. And yet it isn't too, because you've got that health insurance business in the mix. So technically it's not exactly fee-for-service because you've got that negotiating body in the middle of it. And all of those plans are different. Why? Because it's attached to your job and everything's negotiated differently, and everybody's got a different plan and a different option, and see, it's so complicated. But still, at the essence of it, it's a fee-for-service business. So when you have a doctor who works for the system where you're going, it does simplify matters a bit, because everything is at least in one system and the doctor's only dealing with that one thing. They're not trying to run a practice and a business and all the different negotiated plans that go with you. Instead, at least the health system is only making those negotiations. But there's still all those complicated negotiated plans and all those things, but the doctor doesn't have to worry about it. The health system does. If the doctor is not a salaried model physician, their practice outside of the hospital has to deal with all of that stuff, billing and coding and figuring out what's what, and it's a lot, right? That's why our system is so complicated and can be so confusing, and why when you call and say, how much is this going to be, no one can exactly just give you an answer for that. It's never that simple, right? When it's all said and done, what they've been trying to do is come up with, you've probably not heard of the No Surprises Act, but you've probably seen it somewhere. But the No Surprises Act is yet another law where they've come up and tried to, say, hey, when you come to our hospital for treatment, we don't want you to get 47 bills and have $47 million, come up for, next week in your bank account, due statements. But it's still a lot, and the reason is there's a difference between a salaried model and, physicians who practice on their own. And really, there's not that much of a difference in the sense of like quality of care necessarily, and there's still all these negotiated contracts. It's just how many contracts are really being negotiated. The care can be just as amazing, and sometimes if they have a wonderful physician, they'll have their own wing in the facility. You just have to look and see what's what when you're looking for the quality in care in your provider, and you meet the provider and you see what they can do. But at the end of it all, there is a difference in the patient patient-centered experience when you have a salaried model, it seems. And that's what the physician was saying. He said, when I went to one where everybody was kind of operating independently, just within the same building, versus everybody worked for the same institution within the same building, that's what seemed to make the difference to him. He said he could feel the difference as a patient. So, whether it's better or not, there are definitely pros and cons to both. You can see the incentivization could be good, you know, if you're running your own practice and you have your own team and whatever, but it's also a lot of extra stress. It's also a lot of extra negotiations, a lot of extra bills, and you will see that different as a patient in what comes into your mailbox after you've had a procedure, and you might wonder why. Well, that's why. You'll have just a whole bunch of different physician groups and anesthesiologists, and all of that's going to happen unless you're at a single, I don't want to say a single payer institution. It's not exactly the right way to phrase it, but it's kind of close as far as trying to understand the salaried model. And now we have started here, and it's maybe been your experience even if you didn't know it. Sometimes it's more successful to have a patient-centered experience set up that way, but not necessarily true, but maybe. So that's something to consider, and now you know a little bit more about the salaried model. And so now it's time to get out there and get some good medicine and give some good medicine. So thanks for being here.